Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Look at neck pain differently for the next few minutes. Do not think of it only as a tight muscle, a bad pillow, or too many hours at a computer. Ask a deeper question. Why does the neck keep sending pain signals even after the original strain should have settled? And then ask the practical question, how can a small mineral like zinc influence that pain system? Begin with this principle. Zinc is not a painkiller in the usual sense. Do not treat it like ibuprofen, a muscle relaxer, or a quick numbing agent. Treat it as a biological support tool. Why? Because neck pain often lives at the intersection of muscle overload, nerve sensitivity, low-grade inflammation, impaired tissue repair, sleep stress, and nutritional gaps. Zinc touches several of those systems at once. The National Institutes of Health describes zinc as essential for enzyme activity, immune function, protein and DNA synthesis, wound healing, and cell signaling. That means zinc is involved in the very processes the body uses to calm irritation, rebuild tissue, and regulate inflammatory response. Now pause and ask, if the neck is inflamed, overworked, and neurologically sensitized, should we only stretch it? Should we only massage it? Should we only correct posture? No. Do those things, but also examine the internal repair environment. Give the body the materials it needs. Zinc may matter most when a person has low intake, poor absorption, chronic inflammation, high stress load, digestive disease, heavy alcohol use, a highly plant-based diet without planning, or long-term healing difficulty. In those situations, zinc is not a decorative supplement, it becomes part of the terrain. First, understand what many neck pain cases actually are. A large portion of persistent neck discomfort is not a single damaged structure screaming for attention. It is often a network: upper trapezius, levator scapulae, suboccipital muscles, cervical joints, fascia, and sensory nerves all communicating with the spinal cord and brain. Clinical guidance for non-specific neck pain strongly emphasizes education and exercise, especially for chronic cases, because movement retrains this network rather than simply silencing it. So do not replace movement with zinc. Pair them. Use zinc as support while you restore strength, mobility, and confidence in the neck. Why might zinc help? Start with inflammation. Neck pain can involve local inflammatory chemistry, especially when muscle fibers are overloaded, circulation is restricted, and the tissue becomes acidic and irritated. Myofascial pain literature describes trigger point regions as areas where sustained contraction may reduce local circulation, increase metabolic stress, lower pH, and release inflammatory mediators that sensitize nearby nerve endings. Think of it this way. A tight neck is not just tight, it may be chemically noisy. Zinc helps regulate immune and inflammatory processes, so in someone whose zinc status is inadequate, the body may struggle to move from irritation toward repair. Ask yourself, how does a mineral influence pain if it does not directly block pain like an anesthetic? It can influence the background conditions that make pain louder. Zinc is part of antioxidant defense and metallothionein biology, and reviews on nutritional supplements in neuropathic pain discuss zinc's potential relevance through anti-inflammatory and oxidative stress pathways. Chronic pain is not only a message from tissue, it is also a state of altered sensitivity. When oxidative stress and inflammation remain elevated, nerves may respond too strongly to ordinary movement, pressure, or posture. Support zinc status, and you may help lower one piece of that sensitivity burden. Now look at the nerve side. This is where zinc becomes especially interesting. Pain signals travel through ion channels and receptors. One receptor family, TRPV1, is involved in heat, irritation, and inflammatory pain signaling. Experimental work has shown that zinc can inhibit TRPV1 activity and reduce neuropathic pain behavior in a chemotherapy-induced neuropathy model. Another line of research in Nature Neuroscience found that zinc can modulate NMDA receptor activity, a pathway deeply involved in pain amplification and central sensitization. Translate that carefully. This does not prove zinc cures ordinary neck pain, but it does show that zinc is not merely for immunity. It participates in pain processing biology at the nerve receptor level. So ask the key clinical question: who is most likely to benefit? Not everyone. Do not promise universal relief. Do not tell a person with a herniated disc, fracture, infection, inflammatory arthritis, or progressive neurologic symptoms that zinc alone is the answer. Instead, identify the person whose neck pain is persistent, muscular, stress amplified, slow to recover, associated with poor diet quality, or accompanied by signs that tissue repair is not robust. Consider the person who says, "My muscles feel irritated all the time," or "every little posture sets it off," or "massage helps for a day, then it comes back." In that person, look beyond mechanics. There is also human data worth noticing. In a study of people with chronic myofascial pain, participants showed lower intracellular stores of zinc and selenium and inadequate intake of these nutrients. That study included people with neck or shoulder pain linked to myofascial trigger points. Again, do not overstate it. Association is not proof that zinc supplementation will erase pain. But do not ignore it either. If chronic myofascial pain is partly a tissue metabolism and inflammatory state issue, then zinc status deserves a place in the assessment. Now make it practical. Step 1. Screen for danger signs. If neck pain follows major trauma, comes with fever, unexplained weight loss, cancer history, severe headache, loss of balance, arm weakness, numbness progressing down the arm, bowel or bladder changes, or pain that wakes you intensely at night, get medical evaluation. Do not try to supplement your way through warning signs. Zinc belongs in a sensible plan, not in denial of serious illness. Step 2. Examine intake. Ask, how much zinc is actually entering the body? Animal foods such as oysters, beef, crab, fish, eggs, and dairy provide zinc in forms the body generally absorbs well. Beans, nuts, and whole grains also contain zinc, but their phytates can bind minerals and reduce absorption. So if someone eats mostly plant foods, give instruction, not fear. Soak beans, ferment grains when possible, use leavened breads, combine zinc-containing foods with protein, and plan intentionally. The adult daily value for zinc is 11 milligrams, and the recommended intake differs by sex and life stage. The upper limit for adults is 40 milligrams per day from food and supplements combined, unless a clinician directs otherwise. Step 3. Consider testing when the story fits. Do not guess forever. Ask a clinician about zinc status if there are risk factors: inflammatory bowel disease, celiac disease, bariatric surgery, chronic diarrhea, heavy alcohol use, restrictive eating, older age, or long-term poor wound healing. Blood zinc is imperfect, but it can still be useful when interpreted with the clinical picture. Why does this matter? Because supplementation works best when it corrects a limitation, not when it adds excess to an already adequate system. Step 4. Use zinc with discipline. If a clinician agrees supplementation is appropriate, use a moderate dose, often in the range found in a multivitamin or a short-term targeted supplement. Do not megadose. Do not stack multiple products without counting the total. Take zinc with food if it causes nausea. Separate it from large dose iron when possible, because high supplemental iron can reduce zinc absorption. Be careful with certain antibiotics and medications, because zinc can interfere with absorption. And remember this: long-term excessive zinc can lower copper status, which may cause anemia and neurologic complications, so respect the mineral. More is not more intelligent. Now connect zinc to the neck plan. Do this in layers. First, restore movement, gentle range of motion, deep neck, flexor training, scapular strengthening, thoracic mobility, and graded exposure to normal activity. Second, reduce load, adjust screen height, break long sitting, relax the jaw, stop holding the phone between ear and shoulder, and breathe through the rib cage rather than bracing the neck. Third, support recovery, sleep, protein, hydration, magnesium-rich foods, omega-3 containing foods if appropriate, and zinc adequacy. Why combine these? Because neck pain is rarely one lever. It is a panel of switches. Turn down several switches at once. How might someone feel the benefit if zinc is relevant? Not like a dramatic numbing sensation. Expect something quieter, less post-exertional soreness, better recovery after exercises, fewer flare-ups after desk work, improved immune resilience, better skin or wound healing if those were also poor, and a gradual decrease in the irritated tissue feeling. Give it weeks, not hours. Track it. Use a simple diary: pain level, neck stiffness on waking, headache frequency, exercise tolerance, sleep quality, and supplement dose. If nothing changes after a reasonable trial under proper guidance, stop and reassess. Do not become loyal to a tool that is not helping. Ask another important question: why does zinc seem overlooked in neck pain conversations? Because neck pain is usually placed in a mechanical box. Posture, discs, muscles, joints, those matter. But the body does not separate mechanics from chemistry. A muscle under load needs circulation, oxygen, amino acids, minerals, mitochondrial function, and immune regulation. If those are compromised, the same posture that one person tolerates easily may provoke another person's symptoms. Zinc invites us to widen the lens without abandoning evidence-based care. And how do we keep this medically responsible? Say it clearly: zinc is an adjunct, not a standalone cure. It is most convincing when there is inadequate intake, impaired absorption, inflammatory burden, or slow tissue recovery. It should sit beside exercise therapy, education, ergonomic correction, stress regulation, and appropriate medical evaluation. That is the balanced message. Do not sell zinc as magic, use it as physiology. So here is the takeaway. When neck pain persists, do not only ask, which muscle is tight? Ask, why is this tissue not calming down? Ask, how are the nerves being sensitized? Ask, does this person have the nutritional foundation for repair? Zinc can be beneficial because it supports immune regulation, tissue rebuilding, antioxidant defense, and pain signaling pathways. It can be effective in the right context because it may correct a hidden weakness in the body's recovery system. Use it wisely. Check the diet. Identify risk factors. Avoid excessive dosing. Respect medication interactions. Combine zinc with movement, strength, posture changes, sleep, and clinical care when needed. Let zinc be part of a complete neck recovery strategy, not a shortcut. Take care of your neck, take care of your whole system, and take care of each other. We are learning this together like a family committed to better health. See you in the next topic.